We are pretty happy again to present to you the Aliveness Project Group. And on my left-hand side, we have Brian, and on the right hand, we have Joyce Hantuba. Wonderful. I think I got it right?
Yes.
Thank you, I have to ask, yes. So before we start our discussion or a brief interview, I would like you to introduce yourself. I mean, who you are, for our viewers.
Yeah, absolutely. So hi everybody, my name is, I should take this, huh? Hello everybody, my name is Brad. I use he, him pronouns. I am the Outreach and Care Linkage Manager at the Aliveness Project. So a little bit about what I do specifically is I manage a team of the outreach workers. Joyce is one of our star outreach workers. We'll go out into the community and we will test folks for HIV, and then if folks do test reactive, it is our job to get them linked back into HIV care.
Thank you very much. And what about you, Joy? Go ahead.
My name is Joyce Hantuba, and I'm an HIV outreach and testing person. I test everyone, but I like to concentrate on the African-born group because of several reasons, because I'm kind of familiar with their culture and other things.
Oh, thank you very much. So, you've talked about HIV testing. Are there any challenges to get folks get tested, and how do you manage to ensure that as many folks as possible get tested?
Yeah, absolutely. So for me, I will say the biggest piece or the biggest challenge for folks getting tested is going to be stigma. Stigma plays a huge role in why folks do not get tested. I think that people maybe are fearful, or they are scared, or they are worried about what other people might think. And so that for me is probably the biggest obstacle that we have to face. And then secondly, I would definitely say lack of education. We in the US actually do really, really poorly with sexual health education. And so that is a piece that not a lot of people know about. But I know Joyce can talk a little bit about specifically some of the cultural pieces with stigma as well.
Go ahead, Joy.
I relate to culture. Cultural issues affect the African-born community. You know, in Africa, most of the African countries, it's taboo to talk about sex in public. That's something that is not acceptable, actually. So as a result of that, when we go out there to try and test people, or when we go outreaching, they are not coming forth because they feel that's not their field, and that's not my field to talk sex to them, sex lessons or anything to do with sex. So that's the biggest challenge we're having.
Thank you very much. So are there methodologies which you believe have worked out for you, and any other suggestions you'd like to especially involve the African community or the African immigrant community or the African American community, so that it can be possible for you to reach as many as possible?
We've used several ways. We give gift cards. Actually, we award the African-born people more money on gift cards than the other groups of people. We've also tried to get in by arranging cookouts and stuff like that. We gather them together, and that way we've achieved quite a bit, because when they look around, the majority in those groups are African-born, and so they kind of open up a little bit. But we are still working out on that one, so that we can get, if we can get 80%, we'll be happy.
Thank you very much. So, Brad, I need you to talk about the importance of care linkage.
Yes, absolutely. So getting linked to care when folks are first diagnosed is really, really important. For me, I would always say the sooner the better. The really great thing is that we can generally, through our connections with local clinics in the area, connect people very shortly. So the sooner folks are able to get connected to HIV care, the sooner they are able to get on medication. And we know, and this is really brand new information for a lot of folks, that when people are taking their HIV medication as prescribed, they reach a point in their HIV diagnosis where we call it undetectable. And so that means that the HIV virus is so low within your body that you cannot readily transmit HIV. So this is a huge breakthrough that we have had in the HIV community, and it's called U equals U, undetectable equals untransmittable. So it's really great. I think that's the biggest lesson that we preach to a lot of people, is that if, again, somebody is virally suppressed and they are undetectable, they can have sexual relations with their partner and not put them at any risk. And that's such huge news to people, and yet, a lot of folks still don't know about it. So that is the primary goal that we're thinking of when we're linking folks to care, is making sure that they are on their meds and reaching that undetectable piece.
Mm-hmm. That's good. That's beautiful, actually, to hear. There's something I also would like you to put out there so that people can actually really understand this HIVs. We used to call it a pandemic or a scourge, but at least with medication and with proper care, things are actually pretty good. And you've stated here clearly that if you take medication, if it's detected earlier, you can just live a normal life without any problem. So what do you tell folks who are still scared out there? Maybe some of them don't know whether they have it. Do we require a mandatory testing for everyone to be on the safe line, or what do you recommend? Joy, take it.
At the moment, we are not doing any mandatory testing. We just let people offer themselves to us for testing. But, and we do that in several ways. We offer gift cards, and we also offer, like when we go into shelters and pop-ups in town, we offer snacks, water, food, and all that stuff. And I'll let Brad talk about PrEP. We have a new thing in the HIV world where you can take a pill to prevent HIV. And we only do that if somebody is HIV negative. So that's why we encourage everyone to come out and test, because we have something for you even if you are not HIV positive.
Wonderful.
Yes.
That's good information out there.
Yes.
So how does it work? Or Brad, can you expound more on that?
Yeah, absolutely. Yeah. So kind of like Joyce was saying, we always want everybody to get tested, even if you have very minimal risks. I say even once a year, maybe every 6 months if you have a lot of risks. But I think everybody should at least know what it's like to get tested. And so like Joyce was saying, if you test negative, that's great. If you have risk for HIV, we can prescribe you a pill. We at Aliveness have just opened up our very first free PrEP clinic. So we are able to offer PrEP, which is, it is like a barrier for HIV. So if folks were taking PrEP as prescribed, it builds a wall against HIV. So if that person were to ever come in contact with it, it would hit that wall. At its peak, it's over 99.8% effective against fighting off HIV. It is only fighting off HIV, but PrEP is a really, really great wonder drug against preventing HIV. So when we do the testing, we can then, if folks do test negative, get them started on PrEP so they don't have to worry about the risk of HIV. So nowadays, HIV is very, very, very preventable.
Oh, wonderful. So teach me a little bit about PrEP. I need folks out there to understand. How does it actually work? Look, like you take it now, and then you're going to meet your partner later, or how does it actually work out?
Yeah. So for PrEP, it is a once-a-day pill that you would take. And so as you start taking it, the levels of PrEP kind of build up in your body. And so that in and of itself is a barrier against HIV. So even if your body were to come in contact with the HIV virus, with that PrEP barrier, it would effectively hit that barrier. So it is very effective at preventing HIV. You do have to take it every day because it's all about the levels of PrEP that you have in your body. So making sure that you have enough levels to prevent HIV is a huge piece.
Viewers, thank you once more again. We are continuing with the discussion about the Aliveness Project, and with me we have Joe Hantuba and Mr. Brad Bryan. So, who is eligible for PrEP?
Yes. So I think the most important part that we have to let folks know is that PrEP is for folks that are HIV negative, and it is for folks that are high risk of contracting HIV. So when I think about specifically the biggest risk for HIV, we're looking at folks that are communities of color. They are disproportionately affected by HIV. Folks that also are immigrants are disproportionately impacted. Folks that are LGBTQ are disproportionately impacted. So when we're looking at who are ideal candidates, those are the folks that we're thinking of. I'm also thinking about folks that are maybe in a relationship where one person is positive, then the other person who's negative can take that pill so they can still be in that relationship and there's no risk of HIV.
Okay. Thank you very much for that information. And then the other thing I would like to get from you guys is that when you've tested somebody or she or he is positive, there's a project whereby you bring them over, to your organization, you help them, you feed them. Can you a little bit tell us about this, Madam Joyce?
Yeah, when a person tests positive for HIV, we bring them back. We confirm the test. We make sure that they're truly positive.
So you do a couple of tests?
Yes.
Not only one?
No.
Okay.
So we reconfirm the test and then we bring them over and we link them to care, like we make doctor appointments for them, and if they don't have insurance, we arrange for insurance for them. We don't only deal with people with who are like citizens. We deal with illegal immigrants too. Oh. We help them.
That is another question I was actually going to ask. So it's across the board. Whoever is actually living in the community here.
Whoever is living in the community, yes, gets the care from us. Okay. Because if we leave them out, then we won't be able to defeat the HIV.
So your main focus or key focus is to ensure that you eliminate or you minimize transmission.
Yes.
Okay, go ahead.
So we don't discriminate.
Okay.
So we link them to care. We even sometimes take them to the hospital and talk to doctors, social workers on their behalf. We also have a food shelter where we feed them if they need food. We also have a kitchen and a dining room where they can come every day, Monday to Friday, and eat. So my Brad can elaborate on that.
Okay, go ahead, Brad.
Yeah, absolutely. So kind of like Joyce was saying, not only will we help folks get connected to HIV care, which is the main goal for folks, but we're also thinking about some of the other pieces that they need. So you talked a little about folks that are undocumented. So we want to make sure that even if they don't have the necessary documents to live within the U.S., that they are still getting access to their medication and receiving proper HIV care. So we have certain specific procedures, and we'll pair up with different case managers to make sure that even if that folks are uninsured or are undocumented, newly to the area, that they are going to leave with a supply of medications to prevent the spread of HIV. Like you said, that is the main goal for us, is prevention.
Okay. Prevention, prevention, prevention. So guys, I'm going to give you each 1 minute to wrap it up, whatever you think actually is some good news to the community. Go ahead. So I'll start with Joyce.
So what I would say to the community is do not be afraid of stigma. We are here to help. We are friendly. No one will judge you. We just want you to be well and healthy and live a normal life like anybody else. We are here to educate people too. We educate on HIV. We are here to feed you if you are HIV positive and you need help with settling in the community. Our aim is you equals you.
Thank you very much. So what about you, Brad? Go ahead, your closing shot.
Yeah, absolutely. So I think the biggest piece that I was going to say is you equals you, so you beat me to it, Joyce. But I would say for anybody, again, that is nervous about getting tested, it is better to know, because if you are too scared or you're afraid, you could potentially still be living with that virus. So I would rather you get tested, and let's treat that, and let's move on and enjoy the rest of your life, because you can still have a happy and healthy and self-directed life when you are taking your medication and when you know your status. So for me, I would say the biggest message I want to let folks know is to get tested for HIV and to know your status, because it's only when you know your status that you can do something about it.
Thank you very much again, once again, Brad and Joy, for having time to talk to KDR TV crew. We appreciate your time, and next time we'll definitely again arrange for this particular conversation so that we can enlighten our community on how to get safe, on how to know their status, and keep HIV and AIDS at bay. Thank you very much.
Thank you.
Welcome.